Hi, Dr. Nelson here with Chiropractic. I wanted to talk to you a little bit more today about one of the most common things that we see here in the office, which is headaches and migraines. Now, I think that all of us can probably agree that headaches are definitely common, but they're not normal. It's one of the things that I see most often here in the office, and it's definitely something that we've seen some really good changes with, and we're able to make some really big differences for people with headaches and migraines. So one of the common things that I hear is that when people come in, they say like, oh yeah, I get like the occasional migraine or headache. And I ask, well, how often are you actually getting those? And often the response will be like, oh, anywhere from like 2 to 3 times a week. 2 to 3 times a week is a lot. And if you extrapolate that out over the entire year, you're spending anywhere between 70 to 90% of your entire year with a headache. And that's a lot. And it's not something that anyone should have to really go through. You know, and if you have headaches or migraines, you know how debilitating it can be. It can stop you from working. It can stop you from enjoying pretty much anything in life. One of our recent patients, she came in and was talking about how she felt like she wasn't a very good mother anymore because she couldn't put her kids to bed at night due to the fact that she would get a migraine every single night. And so this is something that really affects people. So today I wanted to share with you a little bit more about what causes most headaches that I see here in the office, as well as what we do here in the office in order to make the change and give you your life back. So most headaches are generally going to stem from the top 2 bones here in the spine. So this is C1 and C2, most commonly referred to as the atlas and the axis. These 2 bones are connected to the base of the skull right here in what's called the suboccipital triangle. It's a series of muscles here that create a little triangle shape right at the base of the skull. Now you have a really important nerve that exits right between the middle of that triangle called the suboccipital nerve. That nerve will come out and come up the back of your head and go all the way up to the front. So a lot of times when we get headache cases here in the office, we're dealing with patients that talk about how it generally starts here at the back of the neck and then wraps up around the head and kind of comes to the forehead right behind the eyes. Generally speaking, it's on both sides of the head that is causing this, but it's stemming from that nerve, the suboccipital nerve, as it exits through that triangle. A lot of times we'll see damage to that, like in a car accident, for example. If you get the whiplash, you can actually damage that suboccipital nerve, and that can lead to chronic headaches moving on down the line if it's not taken care of properly. But generally speaking, like let's say you just have like a stressful day at work, or you're sitting there working at the computer, or whatever stress you go through, these will tighten up and they will irritate that suboccipital nerve. Other reasons that we'll see headaches is just from the tension here in the neck, from the muscles up and down. If you have poor posture, if you have other like structural issues, let's say your neck is starting to flatten out and it doesn't have a curve in order to adjust to the stress that you go through. That's another major cause of headaches. Another big reason is the flow of what is called cerebral spinal fluid. It's a fluid that surrounds your brain and goes down into your spinal cord. Oftentimes we'll see misalignments here in the C1, C2 area that can actually block the flow of that fluid so that it builds up pressure inside the head. It can even cause problems like migraines because it's not clearing out trash and putting nutrients into the brain. These are the major causes that we'll see for headaches and migraines. And so one of the key goals that we have here in the office is to remove the tension from that suboccipital triangle. So we're going to be working on like the muscles surrounding that area. We're going to be releasing them to take the pressure off of those nerves, but we're also going to be adjusting with our very gentle, specific technique called activator to realign the spine right through that C1, C2 in order to take the pressure off. Now, one of the key focuses that we have is a special technique that I use for headaches, migraines, and other neurological issues that is called cranial sacral technique, or SOT, sacro-occipital technique. And this involves working with the suboccipital triangle, but then also pressure points around the skull using acupressure points and blocks on the bottom of the spine in the sacrum to help induce the flow around the brain of that cerebral spinal fluid down into the spinal cord, taking pressure out of the head where you get a lot of those pressure headaches, and then also increasing the amount of trash takeout and nutrient input back into your nervous system and into the brain specifically. This makes huge differences with headaches, and oftentimes when I'm actually doing the technique, we get a lot of patients who will come in with an active headache, and once I do this type of adjusting, the sacrooccipital technique, the headache will be 80 to 90% better. We get a lot of people that say, it's like, yeah, before I took the Advil, I wanted to get in and get adjusted, and they never had to take the Advil again later that day. So we can definitely make like big changes based on what you have going on. And that's one of the key focuses of our initial evaluation, is that we're gonna find exactly why your headaches and migraines are happening, and then we will make the best plan moving forward as to how to actually fix that underlying cause without just covering up the symptoms like you would with Tylenol or Advil or anything else, just having those headaches come back again and again and again. And so that's what we're going to be doing here at Cadence Chiropractic, and we really hope that we can help you in the future with any headaches and migraines that you might be dealing with. Because like I said, it's common, but it's not normal, and it's definitely something that we can help with. So if you need anything, please always feel free to ask us, give us a call, and we look forward to seeing you soon. Thank you.